On the medial side of the upper leg, we have the major adductors, adductors of the hip joint. So in this kind of group of adductor muscles, we have the pectineus, which is up here. We have the adductor brevis, which is kind of underneath, but it looks kind of similar to the pectineus. We have the adductor longus, so we have the brevis and the longus, the brevis and the longus. And then we have the adductor magnus, which if we go around to the back, you can see it's this big old muscle, quite a bit bigger than any of the others, which is why it's called the magnus. And there is also an adductor minimus, but we're not dealing with that in this book. And then the gracilis right here also assists in adduction. You can see it's kind of has a similar path, but we're not going to talk about that one in this video. So let's just hide that. And all four of these muscles, so all of the adductor group, have their origin on the pubis bone of the pelvic bones, and they all have their insertion somewhere on the femur. So you can see the pectineus has an insertion a little bit more superior, and then the brevis and the longus, and the adductor magnus, you can kind of see it's a little more posterior, and it kind of runs along basically the entire linea aspera. The linea aspera is this line right here, if we remember. And the adductor magnus has its attachments pretty much along the whole linea aspera. And the pectineus, the adductor brevis, the adductor longus, and half of the adductor magnus, the anterior fibers of the adductor magnus, are all going to cause flexion, adduction, and outward rotation at the hip joint. The posterior fibers of the adductor magnus are going to cause extension, still adduction, because it still is the adductor magnus, and outward rotation, but it is going to cause extension, not flexion. And this all makes sense if we just look at the muscles and their attachments. So for the pectineus, adductor brevis longus, and the anterior part of the adductor magnus, so the hip joint is right about here, and these are all crossing anterior of the hip joint. So if we think of them contracting, they're going to cause flexion of the hip joint. But the posterior fibers over here, posterior fibers are actually on the posterior side of the hip joint. Because this muscle is so big, it kind of spans both sides. So the posterior fibers are actually going to cause extension of the hip joint. And then they're all clearly adductors, because they're all on this medial side right here. If they contract, they're going to cause adduction of the hip joint. And then they're all going to cause outward rotation as well. This one's a little harder to tell, but you can see they all these muscles really attach on the posterior part of the femur. So if we think of them kind of pulling in from the posterior part of the femur, they're really rotating the femur this way. So they're trying to rotate it around like that, which is outward rotation. And then since the gracilis is right here, we want to go ahead and review it quickly again. So the gracilis is also going to adduct the hip, and it also has a little bit of flexion. And this is the one kind of oddball out of this group where it is going to internally rotate the hip joint. So it is mostly like the other adductors, and it is an adductor of the hip, and it also assists in flexion, but it is going to cause inward rotation instead of outward rotation. And I knew I said I wasn't going to talk about the gracilis, but I thought we should just change my mind. I thought we should give it a quick mention, quick little shout out here. And remember, the gracilis also has effects of flexion and inward rotation on the knee, which we talked about in a different video.